I'm Whitley Rose, and I'll tell you how the Affordable Care Act can affect your healthcare coverage. Our award-winning WVU News starts now. I'm Whitley Rose, and coming up this week on WVU News, I'll tell you which meat is most heart healthy. And I'm Whitley Rose. State-of-the-art technology, a new dog, and lots of opportunities. Learn which WVU school is celebrating their accomplishments and their future. You're watching an award-winning newscast produced by television journalism students at West Virginia University. Passengers from 2 Frontier airline flights are being monitored for Ebola. Find out what airports are doing to prevent the spread of this deadly disease. I'm Whitley Rose. If Landrieu wins this term, the Senate will have the highest number of female senators in history. And I'm Whitley Rose. Game day is a special time for West Virginia fans, but not when they're stuck in traffic. Learn how to cut down your game day commute. You're watching an award-winning newscast produced by television journalism students at West Virginia University. While some fans may be upset about traffic, others are unhappy about game day wardrobe. In 2011, WVU initiated a t-shirt amnesty program after an ESPN cameraman zoomed in on a student wearing an offensive t-shirt. That's right, Kylie. WVU hosted its 67th Mountaineer Week. Kylie Clendenin is here to tell us about the week that pays tribute to West Virginia's heritage.
Thanks, Kylie and Whitley.
And it has fans from all over expressing the old gold and blue pride. Anchor Jimmy Zito is here to tell us more.
Thanks, Whitley.
Before we sign off today, we'd like to congratulate women's soccer coach Nikki Izzo Brown for making Big 12 Coach of the Year for the 2nd straight season. I'm Whitley Rose. And each year, around 60,000 fans per game return to watch the team. Jimmy, what makes being a diehard Mountaineer football fan so special? Congratulations to Matt Elder and Rachel Poe for being crowned homecoming king and queen. I'm Whitley Rose. And that's because it takes 21 days to become symptomatic, it's hard for officials to contain the virus. I had a chance to learn what local airports are doing to stop the spread of Ebola.
We can stop Ebola.
Officials have confirmed 2 Ebola transmissions on U.S. soil in Dallas, Texas. The UK and the U.S. have both introduced non-touch thermometers at several international airports. These thermometers are in hopes of catching anyone infected with the Ebola virus, which has already killed more than 4,000 people in West Africa.
I think it's a good start, but I think it's really hard. I think it's really hard to look for a fever in someone, and it could be for a variety of other reasons. And as we found with that passenger in Texas, you know, they really weren't sick yet.
An average of 8 million passengers travel through Pittsburgh International Airport a year. It only takes the touch of one person to spread the Ebola virus. 2 nurses treating Liberian patient Thomas Duncan have now contracted the virus. There was growing concern about how many people were actually exposed, even with their protective gear on.
With things like Ebola, things can be transferred on your body. They give us gowns, masks, gloves, all kinds of protective equipment to make sure that we don't transfer to ourselves, families, or other patients.
Texas health officials say there was a breach of protocol, which resulted in the health officials being infected. President Obama has canceled 2 planned travels to oversee the government's response to this crisis.
I hope that they keep an eye on things and that they find better ways for healthcare workers to protect themselves so that people taking care of Ebola patients aren't getting sick.
One of the nurses infected traveled on a commercial flight from Cleveland to Dallas after she had contracted the virus. This outbreak is leaving people concerned about how close to home this virus can actually be. Right here in West Virginia, there have been 7 passengers tested at Charleston Yeager Airport. All individuals tested negative for Ebola. It's not only important to think about your safety while on the road, but also at the dinner table. When prepared correctly, game meat can provide nutrients that you won't find in your grocery store. I had a chance to learn about the health benefits of eating wild game.
West Virginia archery season has begun, and there are several advantages to hunting your own meat.
With the wild game, it's a leaner source of protein. It's going to be lower in cholesterol, saturated fat. So definitely if you need a heart-healthy diet, it's going to be a very good quality source of protein. Plus, it's also less expensive.
Grass-fed beef can cost up to $26 a pound. Rachel Lawson is an avid hunter who takes pride in pursuing her own meat.
I know where it comes from. I know that if I shoot a deer in the woods, or if he does, or
my dad or whoever that we know where the deer is coming from. We know that it's been eating natural foods in the woods, and we know that there aren't a lot of artificial preservatives.
Consuming venison, you'll be eating neither growth hormones nor antibiotics.
With bow season kicking off, there are many benefits of harvesting your own meat. An average 4-ounce steak consists of 310 calories, while venison consists of only 125. Venison also offers more protein.
Not only is venison better for you, it also provides a bond for families.
Bonding experience with whoever you hunt with, if you hunt with someone. If not, it's just a good chance to be out with nature.
Hunters are limited to harvesting 2 deer per day. Archery season will conclude December 31st.
Venison also offers nearly 50% the recommended iron needed daily for men and 31% for women.
Virus.
That's right, Kylie. A virus is sweeping through the nation's elementary schools. It's important that kids and their parents take the necessary measures to stop the spread of this disease.
A total of 140 people in 16 states were confirmed to have the enterovirus D68. This is an upper respiratory virus that causes flu-like symptoms. Parent Trina Wolf is taking precautions when it comes to her kids.
Normally what we do, hand sanitizer and, make sure we wash our hands thoroughly.
With this virus on the rise, registered nurse Katie Estep tells us what steps to take for those who are worried.
The best way is prevention, but people who are susceptible to it, it's, lots of fluids we recommend, plenty of rest. For those that are more severe, like the children that have asthma or other breathing problems already, supplemental oxygen as they need it.
Experts say to avoid infection, cleansing germs is key. By washing your hands for at least 20 seconds, you can reduce your risk by over 50%. Prevention is key in fighting infection, and school officials want parents and kids to be on the same page.
I sneeze into my arm and cough into my arm to prevent from getting sick and hand sanitize my hands.
West Virginia has no confirmed cases at this time. However, many children are still waiting for their tests to return. Whitley Rose, WVU News, Morgantown.